My name is Ashley Seitz, and I'll be presenting Role B of the conditions presentation on anorexia. The article I selected is called How Does Family Functioning Affect the Outcome of Family-Based Treatment for Adolescents with Severe Anorexia? It came from the Journal of Eating Disorders, and the article was written in 2017. The researchers' purpose was to examine the effects of family-based treatment in relation to family functioning and remission in severe adolescent anorexia. The background. The article explains that treatment using a family therapy approach is currently the top choice for treating adolescents with anorexia, although there is limited research on family therapy in relation to anorexia. Some studies, however, have shown that approximately 25 to 50% of patients involved in family therapy have shown positive improvements from their symptoms. Some of the foundations of family therapy approach include positive family functioning, such as positive relationship patterns and family cohesion, as well as organization and structure, all of which when used in early treatment have been shown to have positive outcomes on patient treatment, while poor family functioning has been related to greater levels of eating disorder pathology and psychiatric symptoms. The participants. For this study, 57 female adolescent participants were selected from a previous randomized control trial. All participants met the DSM criteria for anorexia and had been diagnosed for under 3 years. They were also considered to have severe anorexia. There were 2 groups assigned. 28 of the participants were randomly placed in the medical stabilization group, and 29 were placed in the minimum weight restoration group. There were no significant differences in participant age, illness duration, weight, or eating disorder. The selected participants had completed inpatient treatment, 20 sessions of family-based treatment, and had had a 12-month follow-up. The intervention. In the study, the family-based therapy program for anorexia was made up of 3 phases. There were 3 psychologists and 1 social worker assigned to the participants. There were weekly check-ins, and they were performed by experienced supervisors. In Phase 1, parents were asked to take full responsibility for their child's eating and weight gain. As the child began to show signs of improvement and made healthy changes, the responsibility for eating and weight gain was slowly passed back to the child throughout Phases 2 and 3. The assessment. Participants of the study were assessed at 3 points. The first at the beginning or baseline, the second after completing 20 family-based treatment sessions, and the third and final during the 12-month follow-up. They were assessed based on remission outcome, which was determined based on the percentage of expected body weight. They were also assessed on family functioning and adolescent parent attachment quality. This was measured using the Family Assessment Device and Inventory of Parent-Peer Attachment. The Family Assessment Device and Inventory of Parent-Peer Attachment is made up of multiple categories, which cover baseline characteristics, which were conducted through clinical interview, comorbid psychiatric characteristics, which was conducted through interview and questionnaire, family functioning, which was conducted through self-report, and adolescent attachment relationship quality with parents, which was conducted via questionnaire. The results. The researchers began by stating that the preliminary findings of the study were not what they had expected, and that further research would be needed on family functioning in relation to anorexia. Findings from the study included poor general functioning scores in adolescents, and they were predictors of coexisting diagnoses. 47% had anxiety, 21% had OCD, and 53% had depression. They were also associated with more severe forms of anorexia. Higher general functioning scores in adolescents were associated with better self-esteem and stronger attachment with both parents. Researchers were surprised that results found that attachment to mother and father did not predict remission at any point, and that there was a predicted remission at session 20, but that no overall improvement was seen in family functioning at the final 12-month follow-up. The author's concluding thoughts. Findings from the study did not yield expected results. However, the researchers believe that the study did display the importance of understanding family context from a variety of perspectives in order to help in the treatment of anorexia. The overall findings suggested that family functioning should be assessed as part of treatment, and there should be a more relational focus for adolescents, such as perception of parental control. The researchers also believed that earlier assessment and modification of family functioning could help with early treatment response rates in anorexia. My personal thoughts. I agree with the study and believe that family functioning does have an effect on mental health in both positive and negative ways. I do agree that more studies need to be conducted, and I feel there should be a larger variety in participants, for example, male and female. I also found the results to be a bit difficult to navigate. I believe there could have been more clarity in the numerical values. And finally, I believe the authors may have been a bit biased. They noted many personal hypotheses throughout the article that were not backed up with actual research. National websites. The first website that I chose is the National Eating Disorder Association. This website provides advocacy and support in the fight against eating disorders. There are a variety of tabs at the top. There's a Help and Support tab that gives access to support groups, law support groups, treatment, screening, and helplines. There's a Learn tab, which talks about education about eating disorders. There's a tab that says Get Involved, which shows ways to advocate and support people who are struggling with eating disorders. There's also a blog that has a variety of stories and topics on the eating disorders. The second website that I chose is called the National Association of Anorexia Nervosa and Associated Disorders. This website is very similar to website 1. It's a nonprofit organization working in areas of support, awareness, and advocacy, referral, education, and prevention. It also has a variety of tabs for help and support, education, getting involved, a blog, and a donate tool. This website also provides trainings and certifications and resources for physicians, dentists, school educators, volunteers to help them to spot eating disorders and properly direct them to people who can treat them for eating disorders. The final website that I chose is from the National Institution for Mental Health and Eating Disorders. It's a government website which provides education on eating disorders as well as treatment locations. They also discuss how the National Institution for Mental Health can address eating disorders. The National Institution of Mental Health can help with eating disorders by conducting and supporting research that would be able to be used to help find new and improved ways to diagnose and treat eating disorders. I found a variety of other websites throughout my searching. However, these were the most popularly used sites in the Google search. Thank you.